Call this meeting to order of the Personnel Committee. It is truly 10 o'clock, according to the real clock. First item of business is approve the minutes of the last Personnel meeting. Motion by Supervisor Loeb, second by Supervisor Frazier to approve the minutes. Any discussion? All those in favor?
Aye.
Opposed? Carried. Morning, Ms. Hyde. Okay, privilege of the floor. As SUNY Adirondack, we did pass the budget. I don't think there's any need for them to be here today, so we'll move right on to Human Resources. Review of tracking vacancies filled. Jack, do you have anything? Everybody has a copy? Are there any questions about any of the vacancies? Go ahead, Supervisor.
Thanks, Chairman. Who keeps track of the spreadsheet? Is this your office, Jack?
HR.
Yeah.
Jen and myself.
Yeah, that's quite a job.
Yeah.
Keep us on our toes.
Okay, we'll go right into our benefit package, and I'm going to introduce Kurt Yeager and Matt Schuett to talk to us about health insurance and potentially another item. So,
All right, good morning.
good morning, Matt. Good morning.
Thank you. So I've been given, as you can see in the agenda, an extraordinary amount of time to talk about some very important items.
I'm ahead, so you get an extra minute.
Okay, so we've met with the working group generally quarterly, and the purpose of that is to go over the health plan performance, prescription performance, general outlook, trends, where things are going, budgeting, all that. And just a quick reminder who's on that committee. So we have Supervisors Conover, Garrity, Simpson, Sokol, and Thomas, and then Administrator Ryan Moore. We have Treasurer Mike Swan and Jackie from Human Resources. So I was asked out of that meeting to review a couple items. We have a lot that we review. Some of it's already been presented at the Board of Supervisors, it's my understanding. So what we're going to talk about today first is an enhancement to Warren County's benefit package. This one's been on the radar screen to some degree for a number of years, and we're in a different situation now in that anything that we present, anything that we talk about in regards to enhancing the benefit package or the voluntary benefits is super easy now because you have an electronic enrollment system, because you have that's called Employee Navigator, and with that you're just whatever we introduce to employees for them to choose, A, has no cost to the county, and B, is super easy because there's no paper trail. There's not a whole bunch of paper that people have to complete to do it. So that's the first thing we're going to talk about. I'm going to go into that in a second, is the benefit package. And the second one is going to be an analysis of your plans, of your networks that you have on your health and prescription plans. And we're going to take a deeper dive into that. First, on the voluntary products, we have gone out and looked at a multitude of insurance carriers, and we've come back with different carriers and different options to look at on the menu. The first one was that we presented to the voluntary group to the working group was a voluntary life insurance plan. Okay, again, premise where you start with no paper required, easy to install. The point of doing this, really, the employees, a voluntary life plan, what we can do, the benefit of doing it on a group basis is, of course, it does enhance your package, but number one with this, employees can get, and I guess I'll reference it this way, if any of you have gone through a individual life insurance application at any point, you know how exhaustive that is. There's a whole bunch of questions, whether you smoke or don't smoke, that matters, your height and weight matters, your prescription use matters, family history now matters on life insurance when you apply individually. When you do it through a group, all that goes away. Okay, so what the carriers that we work with, we have a carrier that will provide up to guaranteed issue $200,000 of coverage that an employee can get, and it's in increments of $25,000. Somebody could pick up 25 or 50 or 100 if they want. They can go all the way up to $200,000 without any health questions whatsoever. Okay, so that's a significant benefit of having it as through an employer offered to your employees. Okay, they get to have guaranteed issue is what's called, up to $200,000, no health questions, pre-existing conditions don't matter, all that. Okay. Coupled with that, they can also, if they choose, and again, voluntary means up to them, they can choose if they want to insure their spouse up to $50,000. So same thing, no health questions, status of smoker, non-smoker, all that, none of that comes into play. There's not a health question on it. And then children, dependent children up to age 26 can get up to $10,000. Okay? So we feel there's some benefit to that. It really will help enhance your package. Again, it's been talked about for a number of years, and that's easy to administer and pretty easy to put on the package for you. I want to pause there for a question before I jump into the next one. Yes.
Matt, is that something that they can carry after they leave employment? They could...
Yes, absolutely. They're considered portable. So if you leave the county, you can take it with you. You can also convert it. And I guess the point before I get there is this is term insurance. It's basic coverage. It's not, doesn't have a cash value attached to it. You can't borrow against it, things like that. It's just basic term insurance. Okay, and with that, it's also, that's how it's reasonably affordable too. But you can take it with you, and you can, if you do leave, you can take it with you. You can also convert it at some point if you choose to some form of like a whole life or universal life type plan.
Supervisor Leggett?
He answered my question, it's term insurance.
Yeah.
So.
Yep.
Any other questions on the insurance? Doug?
Would it be like a 10-year term, or is there a specific time frame on the term?
They're rated, it's more like a 5-year term. They're rated in 5-year increments. Okay, so if you're 36, that rate holds until you're 40, and then it's another 5-year bucket from there.
That's for every employee?
Yes. Yes, just to reiterate, completely voluntary. And again, back to the enrollment system part of it, this is going to fall in line with how your health plan is, your dental and your vision at open enrollment. In other words, at health, when it comes time, those of you who have been through it, you may be able to visualize it. You can see the health. You either want it or you don't. It's a yes or no. Same thing with dental, same thing with vision. It would be the same thing here. Somebody say, yep, I may want to consider it. They can investigate it. All the tools are there. Education will be available, obviously, on our end. And for those people that are completely covered, don't need it, they just check no. You know, very, very simple. Those that want it, consider it, they can do it. And I have found, just my experience in working with these over the years, is I'm always amazed at the amount of people who either don't have any coverage, never got around to it, or when they did think about it and are ready to get around to it, their health has changed and they can't get coverage. So we find in these situations a lot of people are excited about it. They can enter into a plan that they just can't get coverage on their own, and you're giving them a open window to have that access. Again, the key with this in an employer situation is no health questions. That's a big one. It's a big one.
Any other questions on this one? Continue.
So just the other part of it was coupled still with enhancing the menu was to offer accident coverage. So you put this in the, many of you will relate this, or the switch will go off when many of the commercials that you hear on TV, the Aflac commercials, right? Similar types of plans. The company that does it isn't terribly important. They're all very similar. But this is a good benefit to have, again, particularly if you have sporty kids, if you're active family. If any of you, again, just thinking if you've gone through any type of surgeries due to an accident. I related it to my son went through a surgery for his shoulder years ago, and you have the date of the accident, you have the ER visit, and then you have an MRI, and then eventually you have surgery, and then any of you have been through this, you have tons and tons of therapy, physical therapy thereafter, right? So regardless of what health plan you have, all of those add up to a fair chunk of change, and you have a very, very good health plan here. Very, very good. But any type of event like that adds, those out-of-pocket costs start to add up. Accident plans provide cash, basically. You can pay for them on a pre-tax basis, and they provide immediate cash to cover those out-of-pocket expenses, to cover some of those holes that happen in any health plan. Okay. Again, voluntary, enhancing the benefit package. These plans are super, super affordable, and employees really like these types of programs. And again, no cost to the county. employees get to choose up or down if they want it. Okay, so these two plans run along. You may recall 2 years ago we put in a vision plan. So remember that? Voluntary vision plan? It's similar type of lines. You're just enhancing your package that I think will impact some people greatly in a good way for them.
Any questions for Matt on either one of these? I mean, we're just trying to enhance what we offer our employees in this day and age, and I really think that life insurance is a great benefit that, you know, when you think about the people who don't even have any, it could enhance what they are able to do. No questions? Thank you, Matt.
Okay, whoop. Next
One
next
other.
one.
Okay. Well, you got that
Feel
extra
that
minute.
hook already. The next one is we're talking about a network discounts. Okay, your network. You have two networks today, and I'm talking on your health plan. I want to put this in the perspective of your self-insured. Okay, you have a self-insured health plan. We've actually been talking about it for a very long time, but you've been self-insured for just over a year and a half now. Okay, and things have been on track. Accruals are working. Everything's on track with it and working well. And I just want to make a quick plug, actually. Sorry, Kevin, but by being self-insured, the county is avoiding. There's a tax coming back into play in January called the health insurance tax. It's on a federal level. It's part of the Affordable Care Act that you're avoiding because you're self-insured, and that's worth 2.5% roughly. Right off the top, if you weren't self-insured, that would be part of your rate package going into the new year. So, you know, that's the one thing I wanted to communicate. But regarding your self-insured health plan, you have two components. When you're self-insured, you know, you pay. If you think about it in its most basic level, you pay the claims of a doctor. You pay claims of a hospitalization. You pay the cost. You pay the cost of prescriptions. The employees have a share of it, but Warren County, pay the difference, right? Now, in that difference, you're not paying actually the cash price. Okay? You're paying what Blue Shield, in this case, is your provider. Those are your networks. What Blue Shield has set up as their contract, their contracted price between the providers, between the hospital and between the pharmacies. You pay that discount, that discounted cost. So it's not cash, it's actually a contract between the network and the providers. Okay, now, there's a lot of networks out there. Some of you would recognize these names: CDPHP, Empire Blue Cross, MVP, Aetna, United Healthcare, a lot of names that we're familiar with on the medical side. Those are all networks that have their own deals with the doctors and the hospitals and the pharmacies. Okay, the same thing on the pharmacy side, as I mentioned, you know, Express Scripts, Optum, Magellan. There's a lot of these different carriers, and they all claim to have the very best discounts or deals with each provider. But how do you know? How do you know which is the best? Okay, it's a tough question. What we're suggesting is in that vein of, we feel it would be appropriate to do a full-blown analysis of your networks. So Blue Shield versus Empire Blue Cross versus CDPHP. And we would have a number of them up there to ensure that their discounts with the providers, and really more importantly with the hospitals, okay, with the hospital systems and on the pharmacy side, are the absolute best for your benefit. Okay? We're not talking disrupting the employees or anything of that nature. We're just talking about getting you the very best network discounts that you can have. And there's certain carriers that do this, or certain companies, I should say. Like a Milliman. Milliman provides this analysis. They would take every one of your claims that has happened. Let's say we looked at calendar year 2018, so we went last year. Between prescriptions and doc visits and hospitalizations and ER visits, you probably have 30 to 50,000 events happen. Okay, tremendous amount of activity because of your volume, because you have a lot of employees and spouses and dependents. Okay, so there's a lot of action going on, a lot of activity. Milliman would take every one of those claims and overlay the Blue Shield pricing, comparing it to all those other networks. Same thing on the pharmacy side, to see and determine which network or combination of networks would be the best option, would be really the lowest cost in the background for the county. Okay, so we think that's it's a good exercise to do, especially if you're self-insured. Cost-wise, it represents roughly about 1/4 of a percentage point of your total cost, of your total claims cost, and that includes all medical claims, all pharmacy, your administration, everything. We have found this could fit this. You could find that it would make sense to move to a lower cost provider. It may show us that you're in the exact right spot, but we feel it's a good due diligence exercise, and it could potentially, that 1/4 of a point could free up a heck of a lot more. You could save a lot more in finding different partners potentially. Okay, so I know that that's heavy, put a lot on you right there, with as far as the network and a little bit of how pricing's devised and all that. So I'll pause for questions at this point.
Thank you, Mr. Chairman. For education purposes, I have several questions, but you can answer them as one answer. The definition of provider, I look at it as my primary position, so I'm not sure where that falls in here. We are self-insured, but you talk about networks, and where does our self-insurance administration, human resources, where do they plug into this whole system, and what's the difference between self-insurance and, it seems like we're still dealing with the networks, maybe I'm wrong. What's the difference between self-insured and just dealing with MVP?
Okay, so first I guess provider, I use that very generically, very general. That's going to refer to any doctor visit in this case.
Okay, so it's still the doctor. Okay,
Yep, your
great.
primary care, that could be a specialist, it could be a number of surgeon, could be a number of different, any claims that are out there really. And that's, I think to your point, when you say could it be MVP, you're self-insured, but you still need a agreement, or you still need a network to link to the providers. Otherwise, Warren County, if you don't have a network, you'd be negotiating with each physician or each hospital system as a county on your own, which is as spread out as you are in the number of providers, it's nearly impossible. So we do rely on a network, and the network today has been set up by Blue Shield, but you're right, there's MVP.
No, I just picked something out of
Yeah, but there's a lot of them. There's a lot of networks that exist, and they each have slightly different deals with the providers and the hospitals and their pharmacies, and that's what we'd be going out and looking at and seeing really who has the best and making the determination if it makes sense.
So we've got Blue Cross. Again, I just picked a name. So Blue Cross is who our network is now. What do we get? What are we doing as a self-insured entity versus just letting Blue Cross do it all? Where's the savings? Where's the benefit? Well, how is it all administrated so it's different? Because we're using their network.
We're using their network, but you are moving, what you had before, Blue Shield was administering everything internally, okay, and with that, they have an extra cost to doing that. It costs more. There's many more layers of expense in between to do that. We've cut out a lot of middlemen by just simply using their network, but not necessarily their full administration. If that makes sense.
So we've picked up that workload here.
Mhm.
Thank you.
Sure.
Supervisor Leggett?
Thank you, Mr. Chairman. Matt, one of our programs is the high deductible, correct? And the county picks up a half of the deductible amount.
Yes.
So with finding a better discount rate, that would give us more buying power on that part, so to speak. It would go further?
Yes. So to your point, if I'm understanding it, would be you have a high deductible health plan, and then the county's reimbursing half of that. So let's just say a doctor's visit around here with Blue Shield, just for fun, let's just say is $100. okay? That's what the actual visit is, and then along the way, the county would pay half of that, and you would pay half of that if you were a member. If there's a network that you go to, and just for illustrative purposes, but if there's a network that you go to where the provider reimbursement is actually $90, right? The county saves on that, and the employee saves on it. Your dollars go further, which I think is what you were saying.
Right. And does the county kick in the first half, or is it split 50 for each bill? It's the first half. Okay, thank you.
Yep.
Good, thank you.
Supervisor Sokol.
Thank you, Mr. Chairman. Maddie, just for the committee's pleasure, that law that's coming back from the Affordable Care Act, can you attribute a dollar amount to that 2.5% of what we're actually going to be?
Yeah, I mean, you're all in right now. Your cost for 2018 was about, to call it $11 million. Okay, and again, that's a function of this. You have a lot of employees on your plan, so somewhere between $250,000 and $300,000 roughly, and 2.5 is an estimate, but that's hitting. So for those of you who, many of you on your towns, you insure your employees, 2.5%-ish or so is going to be built into the rates. It's just you're evading that. It's not applicable to to self-insured plans.
Any other questions? I'll ask you. Yep.
Yeah, just,
Oh,
I think...
you're on the clock.
The point, I think the point of surveying our expense picture and then making sure that what we're paying is optimal, I think is a prudent thing to do. There may be, I'm not going to count chickens before they hatch, but it's possible there could be some significant savings there on the expenditure side.
I was going to pull the committee to see what your consensus is on moving ahead with an RFP to have these different, our claims checked out. Are anybody in favor of it? Show of hands. Okay, I know you had a question, Doug?
Yeah, so you said 0.25%, okay, to have a company basically go over every claim and determine if we're getting our best value or best return on investment. So, what is the downside? Now, obviously, that 0.25% equates to some money that we have to pay for this. But from your experience, is there, other than the cost, which is a big thing, what is the downside that actually?
It's a good question. The downside, so the RFP itself, going through it and the analysis has no downsides. Because, in other words, it's just going to give us a picture. It's going to tell us where things are, where you land, and it'll give us information of whether it's appropriate to sit tight and stay where we are because we're with the best providers, best networks, or it'll tell us it's time to make a change. So that's then the next step. And the change, what we have seen when we've done this, sometimes the change could be worth a tremendous amount of money. So it's also, I didn't really dig into it, but the 0.25% could save us plus percents. We won't know that yet, but we have seen it happen that way in the past. But on a go-forward basis, if it's determined that it makes sense to go to a different provider, that's where the change comes in. You have potentially a different network of providers. We have some that we have to consider and what impact, if any, it would have on any employees. But there's nothing. We wouldn't have anything actionable until we go through the RFP. But the RFP itself, no downside in my opinion.
Peter, you had a question?
What is the 1% actually estimated to be? What is the cost up front, in terms of an estimate?
Yeah, we were saying just between $25,000 and $30,000, somewhere in that. I was just equating it to as what it is in your plan, but somewhere in that neighborhood. And with the chance it could free up a heck of a lot more than that.
I saw it.
Thank you, Mr. Chairman. Would this be an annual exercise, and we would have the option maybe every year to, like we do with a lot of contracts and agreements, either folks continue to do it every year, or how would that work?
We would generally not recommend it annually. I mean, it could be at your discretion, but it would. It's a market check every once in a while. You would do.
5 years?
Yeah, somewhere in that neighborhood.
I saw a hand over here. Yep.
Just as a point of interest, we have more than enough money in the insurance reserve fund to pay for this. So I mean, it's not going to be money that we have to go find someplace in the budget. Because we've got well over $5 million in that reserve. So taking, in my opinion, taking $30 or even $40,000 out of that to go and check this is the money well spent.
Certainly gives us an idea where we are. Any other questions? Yes, Matt?
Do we need a resolution to?
Well, we got consensus with the board, go forward with the RFP, and Ryan will put that together with their help. Thanks, Matt. You did all right.
Thank you.
I'll invite you back. Thanks. Kurt, you want to chime in on it, or?
He covered it all.
Okay, good job. Thank you. Thank you. Okay, vacancies approved for filling by the Oversight Committee. Everybody been through these? Are there any questions on any of the vacancies? I'll ask for a motion to approve these. Motion by Supervisor Simpson, second by Supervisor Loeb. Any further discussion? All those in favor?
Aye.
That's all, folks. Motion to adjourn. Supervisor Loeb, second by Supervisor Frazier. All right.
Are you on time?
All right.